Good morning, good afternoon, good evening, and welcome to today's webinar around AI and health. My name is Matthias Greschel. I'm a visiting research fellow in biomedical informatics at Harvard Medical School and a member of the ITU WHO focus group on AI and health. Before I introduce today's speaker, I'd like to give you some background on AI for good. ITU is the United Nations Specialized Agency for Communication Technologies and Information and the organizer of AI for Good. AI for Good is an initiative of ITU together with 38 United Nations agencies such as WHO to see how AI can be used to achieve the Sustainable Development Goals. If you're interested in learning what AI for Good and especially the focus group on AI for Health is doing, please reach out. We're always looking for people to join the effort. I have the privilege of introducing today's speaker, Effy Vayena, and she's going to talk about ethics in AI for Health, the quest for global governance. Dr. Effy Vayena is a professor of bioethics at ETH Zurich in Switzerland. In her work, she tackles ethical questions that arise at the cutting edge of biotech research in areas such as genomic technologies and big data analytics for healthcare. Effy completed her training in the humanities with a PhD in medical history from the University of Minnesota, where she also worked around breast cancer screening, spent a year doing research at Harvard Medical School, and also spent a lot of time at the WHO. In the past years, she has undertaken a daunting task of co-chairing a WHO expert team on writing down guidance on AI and health, which she will talk about more in today's talk. Dear audience, please ask away during Effy's talk using the Q&A functionality. Effy is a very social and nice person and is happy to take questions anytime. And you can find the Q&A functionality at the bottom of your screen. To those watching on YouTube or Twitter, I encourage you to join the Zoom link so then you can better ask questions. So with no further ado, please, Effy, take it away.
Thank you very much, Matthias, for the invitation and of course for the kind introduction. I'm going to share my screen and start off here. Just let me know if that worked. Did it work?
Yes, looks good.
All right, perfect.
Yeah.
Very good. Well, thank you again. I'm very pleased to be with you today and to be part of this series and your initiative, and to talk about the daunting task that Matthias just mentioned of co-chairing the expert group that developed the guidance that WHO issued last June on health AI ethics and governance. So that's the cover of the report, and it is available on this link. You can download it for free, and I encourage those watching, listening today to do that. What I will do in this talk is try to put that the work that we did in some context of the broader scholarship in AI ethics, but also in the context that of WHO. Then identify some of the key messages from this guidance, and then spend some time in reflecting on what's next after the report and how we can actually move the needle. So before I start, just in terms of content, what my perspective. So I do come from bioethics and health policy, and my angle is a health angle. I did co-chair the group, and also I chaired an expert group on the ethics of digital proximity tracking, something that happened in the course of developing the major guidance. We started in October 2019, before the pandemic kind of broke out. So in the middle of working with the expert group on the AI ethics, the proximity tracking came around, and a subgroup of our group was involved with the ethical guidance there. I was also a member of the Swiss COVID-19 Science Task Force, specifically on digital epidemiology, and I'm served recently on the Greek National Bioethics and Technoethics Commissions. The reason I'm referring to those kind of tasks and roles that I had is because a lot of what I'm going to say is not only formed by my own research and scholarship, but also through my roles in these institutions and in these groups. And what I'd like to actually emphasize is what I am going to say. It is my perspective on the guidance, my experience with it, and it is a personal perspective. It does not represent the views of WHO, but I hope I'm going to be making justice to WHO. Now, again, in terms of how I look at those things and how my thinking is developing when I'm thinking about AI ethics and governance and influences how I saw the development of the report, is I do have expertise in bioethics, public health ethics, clinical ethics, research ethics. These are fields with a rather long history. We've got several frameworks and scholarship. There are processes in place to address some of the issues that come in these different domains. There's a lot of guidance, there is a regulation, and various stakeholders, practitioners, institutions, state agencies are addressed and are actually acting on the basis of this guidance and regulation. At the same time, when we're speaking about artificial intelligence and the digital ethics, a younger field is actually very informative here. But here we have frameworks that are emerging. It is a younger field. We have processes that are emerging, and I should have put /regulation over here. And we do have an interesting discussion around the roles of the private sector and the states from when they're trying to act ethically in this space. So both of these disciplines almost inform the way I see those developments, but also in the work that we did with WHO on the guidance. Of course, those disciplines and the scholarship from both of those were heavily present. So in terms of a little bit more context, I'm using this quote from Powers and Ganassia from the Oxford Handbook of Ethics of AI, which I find very appealing. The ethics of AI maybe is a work in progress, but it is a call that has been answered. We have actually, although artificial intelligence, if you compare it to bioethics, it's a much younger area. We have a lot of activity and a lot of scholarship and a lot of interest, which are fantastic things. We do not have a conclusion, or we don't have set standards or consensus in all of the things we'd like to have, but it is very encouraging that we do have the activity that is going on at the moment. Some of the work that I've done with others is just a pointer to this proliferation of activity around artificial intelligence ethics in general, not specifically in health. So for a few years ago, we published a review of 84 ethics guidelines on artificial intelligence ethics guidelines that we collected until April 2019. Now, the Algorithmic Watch is doing a great job in creating an inventory, a global inventory of those artificial intelligence ethics guidelines. And when I last checked a couple of weeks ago, they had in their inventory 173, and you can search them by the various characteristics. So as you can see, there's a lot of action and activity in how AI should be done ethically, and we have a variety of actors producing and acting, producing these kinds of documents and guidance. At least in our set of the 84, we had seen that 1/3 is produced by the private sector, 1/3 by state institutions, public institutions, and another by academics and foundations. So there is rather fair distribution, let's say, of where those are coming from. I'm not sure if that holds true for the 173, but I'm guessing it's probably not far from that. What we've seen as well in AI ethics is a variety of approaches. So we have a lot of work being done on the basis of human rights. We have a lot of work, as I showed you before, in terms of ethical principles that should guide our work. We have work that is focusing more on design ethics, and we have also tools that are being developed in the context of these guidance documents and separately checklists, aids, etc. Now, these here are not either or. approaches. Of course, a lot of the documentation and proposals that are highlighting ethical principles are also based on human rights and the other way around. So we do have also an overlap, but we see that a lot of the guidance, that we see those kind of proliferation and the variability in what is produced, and in particular in the approaches that scholars, organizations, and others are using in how to tackle the challenge of AI ethics. And here are some examples of what we have seen already of high-level sort of guidance in AI ethics in general. Again, these are not on a specific sector of health that we're interested in here, but in general. More recently, we've seen also the another kind of trend or way of seeing ethical questions in artificial intelligence, and seeing these questions and challenges as a matter of power. Kate Crawford, which I think was also in the series here, has argued that instead of talking about AI ethics, we better talk about power. There is a line of activism around those issues of shifting power. If we want to do AI ethically, again, across the board of AI applications, not specifically in one sector. That's an interesting development. Of course, thinking about power is critical and very important. But again, if we interrogate power a little bit more, we seem to fall again back into some of those basic ethical questions, for example, of fairness, of accountability, of transparency, and things that we're seeing also in the other approaches. So again, the angle of power is very important, but the angle of power doesn't exclude the understanding that those values that we have and the values that matter are critical in thinking, developing AI that is actually serving us well. So AI ethics is work in progress, but in this very, very broad and very colorful, let's say, landscape, we are also having the variety in concepts, the variety, the sometimes ambiguity in how different disciplines are using those concepts. We do see many actors, stakeholders, and power struggles. As I mentioned, we have activism and a lot of activity. We have some serious concerns about ethics washing, and I'm sure those listening today or being interested in this topic are familiar with some of that. That's a development that we clearly want to avoid. Ethics is not about ticking a box and feeling good about having ticked a box. It's about reflection and about meaningful engagement with the challenge. Some have also talked about AI exceptionalism. Should we treat AI as a separate, different thing that requires its own ethics or not? And of course, we have a general call and discussion about whether all of these ethical considerations, analysis, guidance should actually turn into regulation and hard law that will allow developers, companies, and the broader public to actually have a reference that enables us to have more trust into what the kind of artificial intelligence technology is out there and it's used. So that's in very, very broad strokes some of what's happening, or the context in which our work on AI ethics and governance for health was developed. Now, turning specifically to the health question, because for WHO, of course, health was the main focus. And the issue was, despite all that work on AI ethics and somewhat on governance, there hasn't been a specific type of guidance or analysis on health-related AI. There's been scholarship, but not a high-level type of document. So WHO came in to kind of fill this gap. Again, as you all know, the applications of artificial intelligence for health are many in terms of either at the clinical setting, whether that's diagnosis, screening, in clinical care and assistance there, but also very importantly in public health interventions. I think with COVID-19, we've seen up close and personal how artificial intelligence can support disease surveillance. We've seen also other applications that have been deployed very quickly and could have a significant impact on containing pandemics and be used in public health. But also, of course, there is the very important area of health research and drug development, where AI seems to promising a lot. And of course, the part that's very interesting for policymakers, the extent to which those technologies can inform health policy decisions. So these are all areas that are relevant, that are very much focused areas of health that are very important and interesting for WHO, but also for anybody, any other state. Now, COVID-19, we started before COVID-19 started, but with this project, but COVID-19, of course, didn't stop us from doing the project, but informed to some extent the way we were doing it. Apart from moving all our consultations online, we also observed developments that were critical and relevant to the work we were trying to do. This is from a publication of last July from Bernardo Mariano, who was the director of the Department of Digital Health at WHO. And of course, he speaks here about lessons that we learned from this pandemic, the need to establish these new norms and a long-term vision. And 3 points that he's putting out on this editorial was that, at least in the experience that we got from COVID, the human intelligence and expertise need to be at the center of AI applications. New norms around data availability, and in particularly in crisis, need to be established. And of course, the new norms concerning the broad-based benefit, but also, and very importantly, risk mitigation. So these are issues that, of course, they became very profound during the pandemic, but they're also issues that were critical in the development of the work we were doing. Again, from the WHO's point of view, this fit quite well with their digital strategy that was developed before the pandemic. I'm sure some of you are familiar with that. It has various objectives, and including this orange line, which is the digital health governance, with the target to accelerate digitalization of the health and well-being sector. And governance here was important. This is relates to the activity that we did, which was the task of developing the guidance, a group by in WHO sort of typical fashion, an expert group of 20 individuals coming from different parts of the world with different expertise and with different understandings of how AI ethics ought to be, very sort of mapping the kinds of the variability I mentioned in the beginning. And the work that we did was basically the review of the literature, consultations and exchanges in looking at other guidance as well, and trying to figure out what is the most relevant considerations in ethics for health, AI for health, what is the kind of guidance that could be helpful if we were to look for a global standard. So that's by way of context, and I'd like to turn to the key messages of this report. So first of all, the one main issue, and I think it's clear throughout the report, is the purpose of artificial intelligence in healthcare. And the way we used that, the way we understood the purpose of AI in healthcare, at least in the context of this report, was to improve health and equity for all. And it was not just to improve health, so which is an important distinction to be made. And I think that's also evident in the fact that the way WHO was trying to put this forward, or understanding artificial intelligence, is as if it were a vehicle or a tool to help achieve universal health coverage. So again, this is different from thinking the purpose of AI, creating something amazing, which in and of itself is an extraordinary technology and very helpful in some way. The question here was and has been whether that extraordinary technology can be beneficial for all, and whether these kinds of technologies more broadly can help us achieve universal health coverage. Now, the second key message is that this report decided, at least this group decided, to focus on 6 principles that are not brand new. They've been developed and they've been used in a lot of the guidance that's out there already. There was no point in reinventing the wheel if a lot of the thinking and the work has already been done. But what we wanted to do and what we did was to look at which of those principles are most relevant to the sector of health and the potentially more helpful in guiding the development of artificial intelligence. These principles here are not ordered in an order of significance, and they're not an either or. You can have a little bit more autonomy and a little less well-being. I think our aspiration and message was that they all should be guiding the kind of artificial intelligence that we're developing. And perhaps what I wanted to highlight on the list of those principles is the last one, promote artificial intelligence that is responsive and sustainable. In the work we did with the 84 AI principles that I mentioned earlier, one of our observations was that sustainability was one of the principles that attracted the least attention in the global kind of inventory at this time of guidance. And at least the group that worked on the guidance seemed to feel very strongly that sustainable AI is a priority, is a principle of priority, and not something that we should kind of keep on in a footnote. So it's been highlighted as one of the major principles that need to guide our actions. The others: protective autonomy, protect human well-being and human safety and the public interest, transparency, explainability, and intelligibility, the responsibility and accountability, inclusiveness and equity, of course, again, not in the order of importance, but rather as a list, as a bundle of principles that can guide our actions. Now, specific concerns that came up in the context of our report are some that I've put here in these bullet points. For example, when should artificial intelligence be used in the clinical setting? It wasn't just the if question, but rather the when question as well. The big elephant in the room, the digital divide that extends beyond the fact that somebody may or not have a device, but rather on what kind of connectivity they may have, or whether data from particular communities are collected or not, and therefore what kind of impact an AI technology will have on these kinds of communities, the way that data are collected and used, the issues of autonomous decision-making in the clinical practice, whether that is in diagnostics or in prevention or in treatment. A big question about the patient choice in context also of autonomous decision-making, but also very importantly, what happens to therapeutic relationships in the clinical settings when artificial intelligence is part of the picture and increasingly part of the picture. Of course, the big questions of bias and discrimination, I'll come to this in a little bit, questions of safety and cybersecurity. The other question of artificial intelligence in its impact in terms of labor and employment in healthcare and medicine, the question of commercialization of AI for healthcare, and the questions, of course, of artificial intelligence or medical AI and climate change, and that is driven by our principle of sustainability. Now, these were the general concerns, as you can see, are quite broad and wide. And further, perhaps some more information on some specific issues that, as a key messages. Of course, one issue that comes through in the report very much is that issue of bias, particularly the concern that to have this effect, to use it effectively, clearly those systems, the bias that these systems may carry, have to be overcome. That's of course nothing new. It's clear that we're struggling with the issue of bias, but of course, as we know, the complexity of this is immense. It's not just the data that carry bias. Often we have bias in outputs and everywhere else. So the question of how to overcome bias, first of all, how to acknowledge it, that it is there and it's happening, and then ways in which to overcome it if we were to reach the goal of having artificial intelligence improving health for people and doing it in an equitable way. The other message of relevance, I think, is this question of data. At some point in the report, in the discussions we had, we thought of leaving out the big questions of data and focusing on specifically on artificial intelligence ethics as a separate unit. But it was clear that we cannot separate the two, even in a document like this. So a big chunk of one section is actually about data and data governance, particularly because of, as a standalone issue in and of itself, but also because of the consequences that data and all things around data have in the development of artificial intelligence and in its deployment. So issues in relation to the quality of data that are collected, of course, the issues that are related to how bias creeps into data and affecting the predictive value of the algorithms, for example, questions of privacy of individuals in relation to their data, and of course the question of repurposing not only of health data but also of all kinds of data that from which health information can be gleaned. So we did end up with a section specifically addressing the data issues, and in particular, this is a screenshot of the recommendations. In short, these recommendations are really pushing for data protection laws. Again, don't forget, if you come from a country where you have already regulation on data protection, do not assume that's a global phenomenon. So one issue was a recommendation for countries to advance or update or establish their data protection laws if they don't have such regulatory provisions, to establish independent data protection authorities, and again a call to be transparent about the scope of the uses when they of the uses of health data, and another call that is perhaps quite distinct here, that of mechanisms, a call for a mechanism for community oversight of data, particularly in communities, in certain communities, but more generally. And this idea of community oversight we'll see throughout the report, as we deemed it to be very important. I'll come back to that in a little bit. Another message from the report is the role of the private actors, another issue that's well discussed and extensively discussed in scholarship around AI ethics, but particularly in health, that takes a very interesting dimension. A few years ago, with some colleagues also from WHO, who had looked at this health data ecosystem, and back then we were seeing not only this expansion of types of data and the expanded capabilities we had in dealing with all kinds of different data, but also the expanded types of stakeholders that are coming to this ecosystem, increasingly also their expanded roles. And of course, the private sector was critical and has been critical, and it is critical in the developments that we're seeing in artificial intelligence. So at the moment, what we're seeing is not only that the private sector and big tech in particular is recently playing a critical role in developments in health AI, but also that some of this technology becomes part of public health infrastructures. And I think one example we've seen recently with the COVID-19 pandemic is the role that some of the big tech played in becoming part of contact tracing systems and other surveillance systems that typically are state controlled and the oversight remains with the state. So we have this change in the roles. We also have standard setting coming from the private sector. We clearly have asymmetry of power here, and there are questions about the legitimacy of these new actors in the space of health, especially when it comes to equitable distribution of the benefit of health. So one angle we took in the report was acknowledging the fact that the private actors will be, and particularly big tech, will be part of what's happening in AI health. And we can't avoid that. We wouldn't necessarily want to avoid it, but what we want to avoid is that this asymmetry of power actually ends up harming the enterprise of improving health equitably, and instead utilizing those possibilities that those partnerships offer to develop technologies that will help us reach our goals. So that again is a screenshot from the recommendations that are in the section of private actors, and particularly on public-private partnerships that develop or deploy AI technologies for health. A call here to obviously from transparency, and again, this is nothing new. We've been talking about the importance of transparency for a long time, but also what we add here is that kind of transparency should be done through meaningful engagement by the public. And of course, that these kinds of partnerships should prioritize protection of individuals and community rights. And governments here need to seek ownership rights to products and services so that the outcomes of these PPPs are affordable and available to all. I think this, again, if you think about it in its core, it's not a brand new issue. We've had PPPs for many years. I think they take a different, they are of different magnitude in the context of artificial intelligence and big data. And here again is a call to states and to those that engage in whether the private sector side or the public sector side to do it in that manner. The public sector is also a sector that we discussed in the report. Here, again, the recommendations, and again, these are screenshots from the recommendations. The specific recommendation here that governments are not actually excluded by, for example, being transparent and conducting impact assessments before using an AI technology in the health sector. So we're talking about the private sector before, but similarly, the public sector has a number of responsibilities in this context. Again, the transparency question came up a lot, and it turned into a specific recommendation. Governments should be transparent about the use of AI, about the investments they're making, about the partnerships with companies that are engaging with, and whether these are state-owned or government agencies. And again, the call for participation in making decisions, but also in overseeing these kinds of developments. Specifically, the recommendation we formulated is that those decisions about introducing AI systems. So we're here downstream at the deployment, let's say, of these tools in healthcare. These are decisions that should be made not only by civil servants in the public sector, the companies that help develop them, but also through some means of democratic participation of a wider range of stakeholders. And if I could remind you of the thread, I think we're seeing this the sort of community oversight, public participation. We're trying to introduce this across the life cycle, let's say, of AI, from the development to decisions about its implementation, because the point that I think came through our discussion was that that sort of participation can guarantee the legitimacy of some of these decisions, but also, very, very importantly, give the voice to the concerns that the various parties have, particularly those representing the many different publics. So with these being some of the key messages, the idea of the report was to build an ethical approach. And what we highlighted and we tried to do is not to choose one particular approach, like I mentioned in the beginning, but rather to say that we need all of these approaches working simultaneously in some way in order to build this ethical infrastructure or the ethical framework for the development of AI for health. So highlighting the transparent design, also we had the concept of design for values that we have included in more detail in the report, was very important. This promoting inclusivity, including the inclusivity that is required in participation, particularly with engagement of the public in order to demonstrate the trustworthiness to providers, patients, and everyone else. I think this is the participatory approach that we hope is something that will become more of reality. We're not seeing it so far. Support for healthcare workers in the use of these AI technologies, including through education and training and reskilling those who are going to use those technologies. Some tools like impact assessments or regulatory action. So the idea being that we need to pull resources of different types, conceptual, practical processes, in order to build this kind of, in order to get somewhere with the ethics of AI. We also included some tools at the end of the report. That part was the conceptual part. At the end of the report, we have some sort of considerations that designers and developers, ministers, and healthcare institution or providers can actually look at in order to see if those principles and ideas and recommendations in the report are reflected in their projects. And here I want to make a distinction. This is what we added here, those tools, is different from what many have called out as a simplicity trap, the idea that we reduce ethics into a checklist where somebody just ticks off these points and decided that, did ethical AI or ethics of anything that way. This is not it. This is just an aid to help people better digest their report and reflect on certain things, but it's different from reducing all that has gone on and all that needs to be done into 2 pages. Let me turn into some reflections that I think are relevant as well here. Since this guidance was published, I saw that there's been some commentary on them, mostly positive commentary, but also some critical commentary, and I think that's absolutely fair. For example, Privacy International pointed out that although this report warns against this techno-optimism, the report does not challenge the assumption that the use of artificial intelligence in healthcare will lead to more efficient healthcare system, despite as of yet little evidence to back up this assumption. And I think this is a fair point. The fairness is that we do need more evidence to show that artificial intelligence will be a better thing for healthcare. But I think in the report, we tried to, although we are not presenting a dystopia, we tried to emphasize the importance of evidence. And I think every time we see a systematic, systematic research about evidence for all kinds of AI that's available or becoming available is actually very important. I think in terms of evidence, we still have a big kind of question in terms of what is that will constitute evidence for those technologies, how we should appraise this evidence, and what are the right models. But this is a critical question, very important, and I, at least I'm the impression that we highlighted in the report, certainly something that should not be given little attention. Another point that was picked up by an editorial in the Lancet Digital Health was about the importance of democratizing the pathway through this transparent communication. I think this is something that we tried to push with the report in terms of the recommendations, in terms of both being inclusive, but also allowing participation in decision-making, participation from the beginning of the development of a technology to decisions about its deployment. Now, I know that I don't think I've seen fantastic models of that. They are this aspirational to want it. I think it's the right thing to want, but we know that it is quite challenging to do it. I'm just hopeful that if we're pushing it, if we're putting it forward, demanding it, it might become better at getting at it. Another point that was raised in relation to the guidance was that those tools, AI tools that are deployed, and those in particular that were deployed during the COVID-19 pandemic, had few of the features recommended in the WHO guidelines. And I wouldn't disagree with that. When the first contact tracing and technologies came out, this is a quote from OECD. OECD argued very quickly that few countries have frameworks in place to support the extraordinary contact tracing and population-wide surveillance measures that one envisaged at the time, and that's earlier on in the early days of the pandemic. The truth of the matter is that the guidelines so far on data governance, for example, have not been effective or adequate. We've seen distance from theory to practice. There's quite a lot, as I showed you already, a very serious body of work on the theory and on principles, but we've seen less in the practice of how we really implement them. We do have a deficit in meaningful public engagement and participation, and I think we do have a debate about what to do with the regulatory issues. This is the reason also that when the contact tracing technologies came out, or well, the discussion was in the spring of 2020 with WHO, we created that interim guidance to guide at least those developing those technologies, but also the states that were going to deploy them at, of course, large scale, as many of you recall. Interestingly enough, also, since we're at the pandemic, and you can't avoid the pandemic, I looked a little carefully at the Global Health Security Index of 2019. It came out around about the same time we started working on this guidance. You can see here on the left how well countries ranked in rapid response to and mitigation of the spread of an epidemic. You can all draw your conclusions about how well that played out. But what was more interesting for me from that report, it was looking at the relevant issue, which was an indicator that was included in this report about real-time surveillance and reporting. Now, 68% of the countries that were assessed for this report had a low score on this particular indicator. And this is an indicator of relevance to our guidance. For example, the coverage and use of electronic health records, ethical considerations during surveillance, transparency of surveillance data, interoperable, interconnected, electronic real-time reporting systems, indicator and event-based surveillance and reporting systems. So these things, like most countries actually did not do well on those. And I think, again, this is a reminder that preparedness means a lot more, and preparedness on the digital side is something that we need to take very, very seriously, and hopefully this guidance will help with that. Another point that I wanted to raise is that of implementation. Now we have the guidance. We know there's a need for to implement the wonderful things that we've written about and we hopefully want to see happening. But I have to admit that when just before the report was launched in June, the Pew Research Center released their report, a survey they did, or rather it's not a survey actually, they did the quality work, asking experts about around 600 experts about the ethics of AI. So the question was, by 2030, will most of the AI systems being used by organizations of all sorts employ ethical principles focused primarily on the public good? Very relevant question for our report. And 68% of those experts chose the option declaring that ethical principles focused primarily on the public good will not be employed in most AI systems by 2030. Now, that's it's actually sad to see that experts think that. It was interesting to see this coming out just a few days before we launched the report. But so it makes of it for us sober reading to look at perhaps the lack of trust at this point in how we're going to whether we can actually move the needle or not, because moving the needle here isn't about creating some fancier technology, is if we're actually going to develop technology that it's going to be beneficial to people and to our societies. So that's what the experts think. But I think what we're hoping to do is to change that percentage by more action and more activity. Now, at least from WHO's point of view, what they want to do is to support the implementation of this global strategy that they have, including the implementation of this guidance. And they want to do that by going to the countries, having regional plans of action, acting on the recommendations, at least at the state level. They're also planning to create this community of practice amongst the expert groups, including this group with WHO and ITU and a lot of other organizations, generating action and noise, if you wish, in order for these guidance to kind of be more implemented. And also they want to develop, to conduct outreach, not only to the industry, not only to the states and ministries, but also to the industry, civil society, and the global health agencies. So this is the plan, is a plan for this kind of approach to global governance by actively engaging international organizations with an eye towards moving from the theory to practice. I think what the implementation really means is operationalizing those guidelines and not staying in to please, do that thing, be transparent, but rather operationalize the recommendation with specifics, including regulation, process, and activity on the ground. I think another big part of the step towards this global governance is to have the voice of low and middle income countries. One of the things that we originally saw in the development of guidance was that mostly they were coming from the global north and very little from if at all, from the global south. That comes as no surprise. But I think we need to have the fora in which the global south can be represented and can voice their own concerns. And again, next to that goes this notion of technical and regulatory support that international organizations can offer in order to set that sort of certain global standards. And global standards is a point that in the guidance is highlighted. And by global standards, we're not talking only about technical standards, but also standards for all ethical concerns of AI, again, including broader than just the issues, for example, of bias or privacy, but rather impacts on labor, on ownership, and autonomous decision-making. So in a nutshell, this whole report has focused on health, but as in health equity, not just health. It used this mixed approach based on some emerging consensus around some guidelines, but also soft law and hard law. The recommendations include specific recommendations for regulation and the change of culture, ideally in which developing and prioritizing public good is important again. I think it recognizes also the challenge to move from theory to practice and has some recommendations on how to do this. It also addresses multiple stakeholders by seeing the ethical AI being something of a distributed responsibility, which, however, requires some global coordination. Again, this is a living document because things change and the guidance should adapt and evolve as necessary. And seeing global governance as something that we finally have to give shape. Amandeep Gill and Stefan German wrote a piece recently, and they started off by saying AI governance is like one of those mythical creatures that everyone speaks of, but which no one has seen. I hope, or we hope, with the work that WHO has done, that will bring about the political will, the regulatory action, the commitment, and also the commitment for all of us interested in this topic to actually give shape to that creature of governance at the global level, with the purpose of reaching that good of equitable health. So I'll stop here. Thank you very much for listening. I wasn't watching the questions coming in, but I think Matthias probably did.
Very Effy, I'll take care of that. Thank you so much. That was an excellent talk. And I'd like to kick off the discussions by asking who's, so you've mentioned a couple of stakeholders who are behind developing guidance for AI, but who's really driving the conversation globally on AI ethics? Is it patient representatives? Is it researchers, academics, corporations who want their algorithms to be approved?
Well, I think there's a lot, as we've seen, a lot of the drive is by the private sector. And in fact, it's interesting that the whole area, this whole field of AI ethics, although, of course, there were always scholars that were thinking about certain aspects of this, it really came to the fore very, very prominently when the private sector got behind it. And that's interesting. On the one hand, you'll say, okay, great, because we want everybody to be thinking about what is ethical AI and how can we get there. But on the other side, I think it created some of the challenges that we have, or what is the intention of those agencies and of those stakeholders. Who else is on the table? How powerful the other parties are. And we do see other actors coming in, as I mentioned, for example, the EU and states and other organizations, which I think is really important. Otherwise, the whole floor, let's say, is left on the drive by the private sector, which it's not a sort of balanced way of looking at the challenges.
Yeah, thank you. You mentioned in your last slide governance, global governance, and this is also one of the attendees was asking something around how can global governance be realized? And first of all, has there ever been successful global governance for a health topic? And second of all, since algorithms and models can be used across borders and dispatched in any country and health system, how can you ensure that governance and regulations will be harmonized across countries?
Well, it's really, well, we know that's really hard to harmonize regulation amongst countries. One of the kind of interesting examples is also with data, because different countries have different regulatory approaches to data protection. I mean, we are in Europe, for example, we do have the EU's sort of chunk regulation, but we're not the only ones. There are so many variations on the theme. So it's difficult to harmonize. But I think what we're trying to, where the hope is that we will reach some global standard that everybody is going to, like people or states will agree to, or parties will agree to, but then they can, of course, deploy those in their settings with some variation that suits their context. And I think that is not a crazy thing to imagine, and it has happened. We've seen also, for example, global agreements around tobacco. We've seen that in the past, right? We've seen that if we get to the point that we have some high level agreement, yes, it will trickle down to with a variation, and not as you know, it won't everywhere be the same, but I think it's possible to do that. I don't think we'll see harmonization of in the detail, but I think we should have like a core set that we all agree to not go away, deviate from, and that should be possible if there's enough political will to get there.
Thank you, Effy. We had Kathy Smith and another attendee asking about health data. So if there are government commissions AI solutions that require, and of course they do, data from citizens and healthcare consumers, shouldn't it be, how do you ensure that these algorithms are sort of a public good? And maybe also sort of putting this question sort of into the context, what do we as patients, you know, take out of it?
Yeah, that's a great question. I mean, we and I think what if it's a public, and typically what we have is a public institution that holds data of patients, if we speak of sort of patient data, on which algorithms can be trained, they can be used, better algorithms can be developed, etc. I think what's important for patients and those whose data we're talking about is transparent communication about what's happening with this data. Very often we don't have that. We've seen some interesting developments in the UK, both with the care.data and now with the recent development of data, GP data being one needed to be used, particularly also for training machine learning algorithms, etc. And I think transparency about what is happening is something we are not doing so well. I don't think that patients will necessarily say we don't want this to happen. I think they want to know, as we've seen with patient data in the research context of other type before we got the AI developments in here. I think typically patients want to know what's happening and want to know another thing, which is that the benefit that will come out of whatever it is that we're doing, it's going to be distributed fairly. And I think the worry and what excites people in the negative sense sort of way is that they're worried their data will be exploited. And instead of having a benefit that's returned to either them or the community or other patients like them, there's going to be just some profit for some, leaving the others without anything. And that is not the sense of fairness. I think that we should be, and that's, I think, a question of fairness that needs to be addressed.
And how do you think regulators and guidelines will work on algorithms where it's just so hard to understand what the model is predicting? And I'm just thinking of a paper I recently read. I think it's a preprint by Marcia Gassemi, who's now at MIT, and she used X-ray data. And she was perfectly able to predict race based on X-rays. And she was doing all scientific due diligence, controlling for all kinds of variables that could confound what she saw, replicating this analysis in a different data set. But they're still, even, noising the images so that at a normal eye, you couldn't see anything anymore, but the algorithms would still know what race this patient was. How do we go forward having superpower neural networks like this, where we just can't figure out what they do and we can potentially discriminate?
Well, again, this is the checks and balances, right? Since we know that, and I think work like this shows that we cannot have this clean record that we would like to have. I think the decision then is how we're going to use them. We have to understand this as a limitation. and a limitation perhaps not in terms of how the in terms of the development or the kind of science behind it, but a limitation in terms of what it means when you deploy this in a particular setting, in a clinical setting. One of the suggestions we made in the recommendation we made is this idea of impact assessment, right? Assessing what happens when you deploy one type of tool that we may, for example, think that brings a big benefit in terms of, I don't know, efficiency or accuracy or something, but in implementing it in a particular context, we see that it does something else with some form of harm that we need to avoid. So you could have an excellent tool in terms of its engineering part or its computational part, but in the way it's used in practice can be harmful to some communities, some people. And so the idea is, I think, instead of kind of divorcing ourselves from the fact that, you know, if it looks great, if you develop it in a very thorough way, it's going to do the right thing in clinical practice. So that's where we need to have the assessment at that sort of downstream and very carefully done. So that's the one way, and the one point. And the second is, I think we all acknowledge that we have to mitigate, we have to remedy some of the harm that's going to come. And so it will be a trade-off in many cases of how much benefit we're going to get and how much harm we're thinking we're going to be able to tolerate. And there also figure out in what ways we can remedy the harm we'll be making. But I think at least that's what I'm thinking about those rather very difficult types of technology, I'd say. Very exciting, but at the same time, quite challenging.
Yeah. Effy, so we're at the hour. I'd like to close with one question from the audience, which points to the Pew Medical Research Center report you showed, which is sort of around, despite all the progress, why is there this general sentiment that there won't be ever ethical AI?
Yeah, right. That's actually, it's quite, I was quite sad to see that myself. You know, I think there is a general sentiment that that we are not, that the interests that drive what we call progress are not prioritizing the public good. And I think we, perhaps not only as experts, but also as communities, have kind of lost trust in the global and state mechanisms and ourselves, perhaps, of pushing for that kind of change. Because in a sense, you know, we're all somewhat responsible for why we're not moving the needle towards the good that we want to do. But I think it's indicative of that mistrust that has built up, particularly for technologies like this, and with the scandals that have not happened in the space of health yet, or hopefully not, but we are a heavy sort of, we have a heavy past with what happened with all data, big tech, etc. And I think it's really hard at the moment to kind of shed this mistrust from you know, communities and experts alike. But I hope we will.
Okay, Effy, thank you so much. This was a great presentation. I apologize that we couldn't ask all audiences questions, but please reach out to Effy. Also contact us at the focus group on AI for Health, co-hosted by ITU and WHO, if you want to be involved or have more questions. And yeah, most of all, we'd also like to know how you enjoyed this presentation. So we're going to launch a quick poll that will now appear on your screen. And I'd like to point out a couple of upcoming AI and health sessions. We'll have David Scheibitz from Harvard Med next week. We'll have Siad Obermeyer from UC Berkeley talking about bias and algorithms, something we talked about and discussed with Effy today in October. And we'll also have Eric Horvitz from Microsoft in October. You can find all the dates on the website AI for Good. And with that, I'd like to close. I'd like to thank all the technical team behind making this possible. I'd like to thank all the participants and the audience, and most of all, Dr. Effy Vayena. Thank you so much for joining us and giving your perspective. Have a good afternoon.
Thank
Goodbye.
you. Thank you. Bye-bye.